I'm here to share with you a few highlights from studies on violence against women and children. And these studies have been under the umbrella of reproductive health. And I'll have to take you through a series of definitions for common understanding. Violence against women denotes any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering of women and children, including threats of coercion, deprivation of liberty, and whether this is occurring in public or in private. Intimate partner violence is violence between people in intimate relationships who do not necessarily live in the same household, including ex-spouses, boyfriends, girlfriends, ex-boyfriends, ex-girlfriends, or those in same-sex relationships, and it includes sexual, physical, and emotional violence. Child sexual abuse, on the other hand, is any activity with a child who is under the age of legal consent, that is for sexual gratification of an adult or a substantially older child, and the perpetrators take advantage of or violate or deceive children or young people who have less power over elders. Now, these studies will have aims carried by each of our researchers. The first one was exploring the social, medical, and legal context of child sexual abuse from the perspectives of key professionals, community members, parents of abused children, and to estimate the magnitude of health consequences, identifying risk factors among school children. The second aim was assessing responses towards rape against women as experienced by the victims and victim supporters in the context of the interaction between victims, supporters, and formal agencies in Tanzania. And the third one was assessing the effects of providing community education and training to healthcare workers to improve community responses following these incidents of violence. And this was in Kilombero district. And the last one was seeking to understand the healthcare workers and community attitudes and perceptions about intimate partner violence, their role in support, care and prevention, and feasibility of introducing routine screening tool for women who are attending healthcare settings in Temeke. So what are the health and policy issues? Noting that Tanzania ratified the UN Convention on Elimination of All Forms of Discrimination Against Women in 1995 and other such conventions, one of the key areas is the need for reviewing some of the laws, like Sexual Offense Special Provision Act, which came into being from 1998, also law of 1971 regarding marriage, which allows children 14 years to get married. As long as they have got menarche, they can get married. And again, in 2008, after sharing this information with different people and policymakers, the gender desk was established at police stations. Previously, when you are interrogating cases at police desks, like you have 3 panels of people. One side there you have a thief, in the middle you have accident case, on the right side you have a case of rape or child sexual abuse. Each is doing independently, but once they hear anything about the abuse which is being reported here, they all turn ears to that one. And this is the basis for starting the gender desk. at least the women or the ones reporting would open up. Otherwise, asking them in that sort of audience, nobody can open up. Again, in 2010, there was formation of National Multisectoral Task Force, a watchdog against child sexual abuse and other violence in issues. I am a member of that team. In 2014, it was agreed to start the one-stop center in order to address the violence issues. And so far, there has been an intimate partner violence screening tool in use in health facilities now. Here is some in under 18 law of Marriage Act of 1971 tells you can get married. Under 18, like 14 years, 12, 13, 14 years, as long as she has attained menarche. But on the other side, Child Act says you are a child. Where does this child go? It's a question mark. And these are the conflicting laws. This was handling of sexual offenses in Tanzania, a scheme to show the handling of sexual offenses. But the importance of this, I want just to share, is that from the community, a few of those cases of sexual violence or intimate partner violence will come up. Some may go to non-government organizations like Tanzania Crisis Center or others. Some would go to public health, hospitals, and some would go to the police. Crucial to all of them is having PF3, which will be carrying the report that will be used in deliberation of cases. If you go to the hospital straight, previously they used to ask you to go to the police to have PF3. Otherwise, if you go to the police, you get the PF3, you come straight to the hospital, it's filled, your results, which will go to court for deliberation of cases.